Hi, I'm Dr. Diamandis,
And I'm his nurse, Luz.
and we would like to welcome you to our RHA Daxxify virtual event. I want to encourage you all to stay until the end of our presentation for the live Q&A. You will be able to submit your questions via the Questions tab, and I will be answering live.
With me.
As a special thank you for joining our virtual event, there will be a giveaway. Someone will win a perfect derma peel valued at $250. In addition to the giveaway, Daxxify will be $7 per unit, and when you schedule for an RHA filler appointment, you will receive a free Daxxify lip flip.
If you schedule by April 30th.
Dr. Diamandis, what can the RHA collection treat?
Well, RHA is a great product, especially as an introduction into our cosmetic world. It's designed to really take care of any volume loss or facial changes that you start to notice as you get a little older. For example, in your case, you have beautiful bone structures. However, we can enhance the nasolabial folds. We could also balance out the lower part of your face with a little bit of chin augmentation or even angle augmentation with the fillers. It's a great combination with surgery or as an introductory into the cosmetic world. Some patients even ask us to help them do their rhinoplasty. Instead of doing a traditional rhinoplasty, they can have what's called a liquid rhinoplasty, where we can make some changes with these fillers that are a little more temporary. However, they give you a kind of an idea of what your nose could look like down the road. Some of our patients ask us to just help at the tear trough area. We start to notice some bags under our eyes, and this product, especially Redensity, is a really nice product to manage those tear trough areas. I'm often asked, how long will these results last, or when will I see the results? Well, what's nice about RHA is that you can see the results immediately. And most of our patients go home that day and resume normal activities. I like to do what's called a precision session around 6 weeks after to do any fine tuning, but most of my patients will see results within days. So it's a really nice social interaction product because we could do something for them and they could look forward to a social event in a couple days and look their best. The new products are cross-linked in such a way that they're lasting 15, 16 months. So it's a really nice long-term procedure for patients. Some of the smaller tear trough, smaller primed products such as Redensity will last about a year. I often like to put a program together where we have what's called a cosmetic maintenance program, where maybe every 16 to 18 months patients come in and we're able to just fine-tune their results with a lot less product. So it ends up being a little more cost-effective, and more importantly, they get to enjoy the results full-time.
So what is Daxxify? Daxxify is the newest and most modern neurotoxin on the market. Daxxify is FDA approved to smooth moderate to severe lines between the eyebrows. It's the only long-lasting frown line treatment powered by a peptide. And most patients are reporting a 30 to 40% longer duration than their conventional neurotoxin. And it's also the only toxin that won Time Magazine's Invention of the Year. How is Daxxify different from other neurotoxins and wrinkle relaxers? Daxxify is the only peptide-powered neurotoxin. The peptide is hydrophilic. It loves water. Patients are reporting that they see positive changes in the texture and tone of their skin, getting that Daxxify glow. No animal byproducts, and it's vegan, and the only neurotoxin manufactured and made in the U.S. So what can Daxxify treat? Daxxify can treat the same areas that you're currently having treated with conventional neurotoxins. It definitely helps with the angry or 11 lines between the brows. You can have your forehead treated, your crow's feet, your masseter muscle for grinding or bruxism, anywhere that you're currently having treated with your conventional neurotoxin. When will patients see results, and how long does Daxxify last? Patients will see a softening of the lines within 48 hours, but for full correction, we give it 10 days, and then we make our assessment after that. So how is Daxxify a great addition to the RHA collection for full face correction capabilities? Patients have reported an onset within 24 to 48 hours, full correction after 10 days, and a gradual return to movement. Daxxify is long-lasting and slow to wear off. Daxxify is also the only peptide-powered neurotoxin, and just like RHA, it's the newest innovation on the market. Toxins and fillers actually complement each other, and they don't compete against each other. You can get RHA and Daxxify in the same visit. So this beautiful patient here has come in to have her 11 lines treated with Daxxify today. So I'm going to have you go ahead and look at the camera and furrow your brow like you're really upset there. Already she's got a lot of muscle movement in her 11 lines. So these are the points where we're going to do her injection. So I'm going to have you furrow your brow one more time for me so we can see where she's recruiting from. And I'm going to have you relax and then look at the camera again and furrow your brow. You'll see where she's recruiting from. So we'll treat her with some Daxxify today to relax those angry 11 lines, also known as her RBF. And I will show you some after photos. After about 10 days, we'll have her come back so that we can get some pictures with her relaxation.
Thanks again for spending your evening with us. We really appreciate it.
The winner will be contacted by either email or phone, so check your text messages and emails and reply back to book a complimentary consultation with Dr. Diamandis or myself. We will reach out to you to schedule your appointment.
Thanks again.
Hello, everyone.
There I am. Hello, everyone. Thank you for attending our virtual event. And I want to apologize for my horrible acting. As my daughter says, it's very cringeworthy, but I promise I'm better at answering questions than I am presenting these things. But there's a great question. How long has your office been doing these treatments? Well, I can tell you that we've been doing one form of tox or biologic fillers for over 25 years, and they've been extremely high therapeutic index, which means that it's very safe, minimum side effects, and really very effective, especially for the introduction to cosmetic world where you're trying to kind of age gracefully without being overdone or over surgerized. So yes, it's really been a great game changer for us with these new longer lasting products.
Alrighty, so we have another question here, and the question is, do you charge by the unit for Daxxify? So our office charges per the area. We are going to be having a special on the Daxxify, which is going to be $7 per unit, but we like to give our patients their individualized treatment, which means that, you know, a patient may need 20 units, another patient may need 25. So we're going to treat you as an individual, and we're going to make sure that you have maximal results.
Another great question. I have frown lines along my chin line on both sides. Can they be treated with Daxxify, or will I have to have a facelift? Great question. As we start to age, that's kind of the one area that you start to notice, the jowling, the marionette lines. And often, if you allow to kind of get into the world of fillers early, you can really prevent the surgery down the road. And really, because we live in the Midwest, we don't want to have that over-surgerized look. So the earlier you could get started with redensity, biologic fillers, Daxxify to slow down that process, the less likely you'll need surgery. Or if you do need surgery, it's much less involved.
Another question we have here is, I have a tendency to metabolize fillers very quickly. With this new filler, will it act the same way? So RHA is the newest, best cross-linked filler that I think Dr. Diamandis and I have come across. Very flexible, very dynamic. Patients are seeing longevity with the RHA fillers. So hopefully, and everyone's an individual, so you are going to metabolize it a little bit different than the next person. But what we've been hearing is that it lasts about 15 to 18 months with the RHA, where other fillers had only been lasting 9 months to 12.
That's correct. I think that there's also some biologic stimulation with this filler where you're actually getting new collagen fibroblasts being made, which I think gives you the longer term results. So we are able to also augment some of the filler with stem cells, with PRP. There's other things that we can do that's kind of cutting edge that'll allow the filler to even act a little longer. But again, initially, the filler itself is very, very exciting because it does correct a lot of the simpler first-time problems.
Another question that we have here is, will someone need to come into the office for a visit, or can someone from out of state call the office for advice? So just like this virtual event, we have had many virtual consultations in the office with patients. 99% of the time, they convert into a live patient, which we love. So yes, we will try and cut out a lot of the extra travel time and make it convenient for your schedule, and we can do virtual visits.
Yes, we've been fortunate, and we've had the fortune of treating many out-of-town guests, and we really try to maximize our visits, minimize downtime. So yeah, I think with this new virtual world, it really has allowed us to really help a lot more people.
Dr. Diamandis, this is a great question for you. I want to know a little bit more about the weekend lift and if you use RHA products with that procedure.
Great question. So the weekend lift was something that I invented, trademarked, 25 years ago now, and it's designed to really address the early ages of the early signs of aging that we start to see in our 40s and 50s, and it's designed where there's multiple steps that I get to use to really maximize the vertical vector pull. There's 3 steps to it, and one of the steps is that I do a little liposculpting and use those stem cells in addition to our RHA filler. And by what I've noticed is by combining the stem cells and forming a scaffold, I'm able to really get permanent changes with the weekend lift. So the weekend lift is a surgical procedure, but as surgery goes, it's a quicker recovery, much less surgical time, and it's a great way to really rejuvenate earlier on without people actually seeing that surgerized look. You just look better without having big face neck lift.
And Dr. Diamandis, what can a patient do to prevent bruising before coming in for either filler or toxins?
And there's a lot of things that contribute to bruising. Some people genetically are just bruisers, but there's homeopathic medicines that we use, arnica, turmeric. There's other products that we try, for example, alcohol, minimize the alcohol use, the other Advil, leave. So there's pre-op medicines and procedures that we've really been able to use initially to prevent a lot of bruising.
We have a really nice protocol that we use at the office. So if a patient is interested in coming in for fillers or for toxins, we can give you recommendations over the phone before you schedule. If it's someone that comes in the same day that would like the procedure done the same day, as long as they aren't on those blood thinners and things like that, it can be done the same day.
Right. And most patients really don't have, the needles are so small now and it's such little trauma that really bruising is minimal. But there are things that we can do with our protocols.
That was one of the next questions actually was, does it hurt to have the procedure done?
And we really take that into consideration. We want this to be a pleasant experience. So we've been able to use topical anesthesia initially to help numb it up. The medicine itself, the RHA, has local, so as we're injecting, it's actually numbing the area up. So no, it's really minimally painful, and we're cognizant of that. And so we try to minimize it and make it as comfortable for you as possible.
There's a question in here. Is 70 years old too old for fillers?
And that's one of those questions that depends on your aging process and what kind of correction you want to do. If there's just a few lines that bother you or a few specific areas, then no, your 70s.
I think everyone's a candidate for fillers and toxins. So if there's little lines that you want to help correct, if you've already had procedures done in the past and you just want to maintain things, I think everyone is a candidate for a filler. Just really depends on your realistic goals for what you're going to look like after it's done.
And that's important. You want to make sure that you're comfortable. You have a good goal in mind of what correction, how much of a change you want. And I think fillers are fantastic for that.
Especially, we've seen really, really beautiful results in the marionette and nasolabial folds, which is one of the questions on here.
And that really is kind of the trouble area as we get a little older. These marionette lines get deeper, and you don't want to have surgery, or you aren't a candidate for it. I think fillers RHA is a great complement to that.
One of the questions on here is regarding financing for fillers and toxins or just surgical procedures. So Dr. D stays out of the billing. Our office does offer care credit, which is financing. We also take flex spending, HSA. We take cash, check, credit cards. So yes, we are open to our lender giving you an application for that, and they do all that with the patient so that they can schedule. So yes, fillers, toxins, surgeries, peels, everything that we do and offer in the office. Alrighty, let me go down this list. I have a tendency to metabolize fillers. Will RHA act the same way?
It's because of the way it's cross-linked, we find that people that are high metabolizers will last probably double what the Restylane or Juvederm will last. So it's kind of a way of thinking is if something lasts 6 months, this will probably double. But we're able to augment and scaffold. So if you are a high metabolizer, there's ways of using different types of products together to enhance the results so that you don't metabolize. And that's what's great about RHA is that there's different prime levels. So we can use a thicker, stronger one as a base, and then a little finer one for some fine lines. So yes, it does. It does for high metabolizers, and we have a lot of them. It really has helped them because it really does double the duration.
So you partly answered the next two questions. Does Redensity work for lips? And I just want to let everyone know that RHA 3 was also just approved for the lips, which is a little thicker, longer lasting lip filler. So you can have that done in the lips in addition to the Redensity, which will help with the little smile lines or smoker's lines or whistle lines or kissing lines, whatever you want to call them. Right. So it can be a combination.
And that's really very important. One filler does not fit all lines, so you really have to be comfortable with adding multiple fillers to correct an area. And the thought back in the day was, oh, you fill this, it'll be no. You really have to think of these lines in 3D, in 3 dimensions, and that yes, a heavier RH3, which has been approved. Plus maybe a Redensity or something that's a little higher, lower prime together really does work well. So yes, we're able to really treat a lot more.
So you actually just touched base on the next question was, can this be used on top of existing filler or do I need to wait?
No, obviously, as long as you don't have any problems with the existing filler, no reactions, no side effects from it, often we'll just layer a second layer of filler, depending on what you need corrected. The key really is important is that once we get a nice correction and you're really happy, maintain. That's really what we found in the last decade is that patients that have a plan where they come in once a year for a maintenance program or a precision session is what I like to call it. It really allows the filler to stay, and you don't have to start over every year where we're just adding a little bit. And at that point, I could use, and Luce could use RHA2, RHA3. We could use different products and less of it, but still maintain the results. So really, I think that's the long-term goal for patients is you kind of put it as a maintenance program and you just.
And what would you recommend, Dr. Diamandis, for bunny lines with a little deeper than soft furrow in their brow?
And when you say bunny lines, we're talking kind of these little lines here?
Yep, lower than the glabella wrinkle, closer to the nose.
Yeah, and that it's genetic. Some people have really deep, strong bunny lines, and other people have just tiny ones. It really works well when you combine a tox such as Daxxify with a filler, and you do that at the same time so that you relax the muscles that are causing those bunny lines, but then you fill the bunny lines that have been created. And so by doing them together, you're really able to maximize the result. And the key with it is you don't want these lines to keep getting deeper. And that's where Daxxify with Redensity really work well.
That was one of the next questions. Can I get RHA and Daxxify at the same appointment?
You can.
So yes, the answer is yes.
You can.
This one's a great one. It's a statement, I guess. I understand that you're quite an artist, Dr. Diamandis. Do you find yourself sculpting and trying to find symmetry within your facial artistry?
I do. And really, art as well as cosmetic plastic surgery is all about facial harmony and balance. And so whatever we're doing, that's kind of what we're achieving. So yeah, I think they do go hand in hand, and I think that's why I love what I do.
Awesome. Alrighty, let me see what else we have here. Someone's tried arnica in the past and it hasn't really worked for them, so we can address that with the pre-op and giving
sometimes there's something else that's going on, and so that's where sitting down and talking with us and alleviating and coming up with a history that says, okay, maybe it's not, there's something else that's causing, because really people shouldn't bruise a lot. And if you do, then we have to figure out why and stop that, because it should be pretty easy.
Oh, just a quick reminder for everyone. There will be a message that you'll be receiving as a reminder, and please reply with the code word filler so that you can be contacted for a complimentary consultation. That's it.
Oh, perfect. Perfect. Any other?
A patient is asking for a specific look for their lips. Will this RHA line work for that type of procedure? And that one is it's a little tricky.
It's a multi-level question, because the lips are very challenging. And Lucy, as you can confer, their fillers do not change the anatomy of the lip very well. Not RHA, not any type of filler that we have. And so when you start to ask for larger lips, that's where the RHAs are fantastic. But when you start to ask for Cupid's bow and changes of the lip, that's where surgery, which is what I call a lip lift, is really successful, because you can actually contour and change the anatomy of the lip, a Cupid's bow or a little rounder, fuller vermilion. Those are things that are really, really changed with surgery, and that's where lip lift. And that is a procedure that we've been doing for years, and it's a very high patient satisfaction procedure where patients, it really changes their facial features just by changing the lip contour, shortening the lip. Because another thing that's interesting is as we get older, our lip line, our lip length actually lengthens. And so not only do our lips get smaller as we get older, that this distance from here to here gets longer. And that starts to age people. And that's where when you look at somebody as they get older, you start to look and say, why did they look older? What are their teeth? Where's that big smile that they used to have? And that is part of the aging process, which really can be reversed with a nice procedure, a lip lift. And that's where you get in trouble, is when you start asking filler, even as good as RHA is, to do. It can't do that. Or a Botox or a toxin or a Daxxify. It won't change the contour of the lip. So if that's really what you want, then you're more of a candidate for the lip lift.
Dr. D, someone in our thread has had lipo on their double chin, and now the jowls are what they're noticing, because this is flatter. They're noticing their jowls a little bit more. Would RHA help to camouflage that, or would they need to be seen?
It would. Depending on how much of the depth of the marionette lines. And as we get older, the transition between our jaw, our chin, and our mandible starts to deepen. And so as that happens, it's really what we're calling jowls. Well, that can be corrected initially. And what I love to do is early with RHA, stem cells combined. PRP was a question that by combining that, you could really soften that transition permanently. But once you get past a certain age, that's where the weekend lift is perfect, because it's a vertical pull in combination with the transition, making it really a great correction that as you age, you're always going to be ahead of where you were before. So by doing something like a weekend lift earlier in your early 50s or late 40s, it allows you to age gracefully for the next 10 years. And then down the road, you may not need a face neck lift. You may just need a weekend tuck. So kind of what I've learned over the last quarter of a decade is that the sooner you start to rejuvenate and take care of yourself, the better and the more gracefully you will age. Where you get in trouble is when you're a little older, you haven't done anything, and then you decide, okay, now I want to do rejuvenation. Well, that's where people start to look funny or change, because you're asking a lot of a surgery, and you don't really want that, especially in the Midwest where we live. You want to age gracefully where people don't pick up on the fact that you've had surgery. Really, they want to say, gosh, did you lose weight? You look great. Or, boy, did you do something different with your hair? That's our way of saying you look better, but it's still you. And that's incredible. That's really what good cosmetic surgery is all about. And that's the art part. That's what I enjoy the most, is where I allow you to age gracefully, but still look like you.
Regarding the RHA and Daxxify collection, are there ways to correct the darkness underneath the eyes or wrinkles underneath the eyes?
Challenging area, and it's tough because it's multifactorial. And what that means is the darkness is genetic, and it's usually something mom and dad gave you. But as we get older, there's multiple things that start to happen. One is that Charlie? One is that the skin starts to get thinner. And so as you lose collagen and fibroblasts, your skin underneath your eyes, which is very thin to start with, even gets thinner, and therefore becoming more translucent, reflecting off the blood vessels, getting darker. Then you start to get fat pockets under the eyes. You start to flatten your cheeks. You start to lose your cheeks. And then obviously the fourth thing is the wrinkling. So by adding all these little changes that occur under the eyes, there's not one correction that will address it, because it's so multifactorial. And that's where people get in trouble, where they're like, okay, I just want you to do a peel. That should change everything. And a lot of times it just corrects one part of the problem. So that's really a place or an area that you have to come in and have somebody like us who knows to help address, okay, this is what we need to do to address it. No, by itself, RHA or will not, it'll soften maybe the wrinkles, but it won't take care of the darkness. So it's a tricky one. It's one of those that you really do need to have somebody. I
have one last question here.
Okay.
A patient is interested in possibly having a liquid rhinoplasty with the RHA line. Could they have it done and go back to work the same day?
They can. And again, with our pre-op routine and our management, where the bruising is minimum, the swelling is minimum, my patients most often have the procedure, go back to work, go back into society without really worrying about it. The important part of the liquid lift is the material that we use and how much of a change we want to do. So it's not a procedure that I recommend. You go, have the doctor do it, and then you just leave. It's one that you come in, you meet, we talk about your nose. You show me pictures of patients that noses you like or noses that you don't like. And then together we do the liquid lift to make the changes. Again, with the liquid lift, my hands are a little bit tied, so I can only correct a certain amount. That's where the rhinoplasty comes in. And a lot of patients will do a liquid lift, enjoy for a couple of years, get the effect, the subtle change, and then come back and say, okay, you know what, let's do the rhinoplasty. And so that's a nice option too.
Fabulous answers. Thank you very much.
No, it's my pleasure. You guys did great. This was fun.
Awesome. So we are getting ready to wrap up unless someone wants to add another question. I do want to remind everyone that the Daxxify is going to be $7 per unit. We are having a special on the RHA fillers, which you can give the office a call, and the ladies at the front desk will go over everything with you. I also, we are giving away the Perfect Derma Peel, so make sure you reply to that text with filler. I did see someone that replied and didn't use the word filler, but we'll still be able to find that because I wrote down your name here. So if no one else has any other questions, I think we will wrap it up for tonight. And thank you so much for hanging out with us. It was our pleasure.
It was fun. I
fun.
really enjoyed it. And come and see us. I think that's the key. Is let's build a rapport. Let's talk, because there's a lot of neat things that we can help you with.
Okay, I see someone said that they didn't get the text, but we'll make sure that we get it sent out again, and you'll just reply with filler. It's not a problem at all.
Great.
Awesome.